Welcome to the Nexus of Health, Poverty and Behavior. Oh, I see you exchanged that with nutrition already. All right. For nutrition, behavior instead of nutrition. That's great. We have, unfortunately, only 2 presentations here today. We have Jakub Polansky and Stacie Gobin. The second presentation, unfortunately, or the second presenter, unfortunately, didn't make it. There were some communication issues, it seems. But nevertheless, I'm very much looking forward to this session. Here's for you some advice on language settings, depending on whether you want to listen in English or in Russian. Both is possible. You have to choose the language. Can you go to the next slide? Yes. Here you can see where you can select your language. Both presenters will present in English. So if you would like to listen in Russian, make sure you choose the Russian selection such that you can listen to the interpreters. Okay. My name is Susan Steiner. I'm the moderator of this session. I'm a researcher at the Leibniz Universität Hannover. I was involved in the very beginnings of the Life in Kyrgyzstan study. So between 2010 and 2012, together with Tilman and Damir and some other colleagues, of course, we set up this entire survey. And then it took off from there. So it's really exciting for me to see how it has developed and that it's still ongoing. And to be honest, poverty, health, and how did you rename it? The session behavior, I think, are exactly the topics why we started the Life in Kyrgyzstan study and how we designed the survey from the beginning. So these have always been our topics of interest. To be honest, the project that funded the first 3 waves of the survey was called a study on household well-being and behavior. So that's exactly it. So we are right on the spot for this topic. Now, thinking about health, of course, I don't have to, emphasize why thinking about health is important, especially in 2020 during a global pandemic. But it's been our interest from the very beginning of the LiK study. So some housekeeping. Every presenter has 20 minutes for a presentation, and then we have about 10 minutes. Maybe we can increase this to 15 minutes of discussion. For the audience, please leave your questions or comments to the presenters using the Q&A function, which you can see on the bottom of your screen. I will later address these questions or comments to the presenters. Jakub and Stacie, I'm going to give you some time notice. I'll let you know 5 minutes before your finishing time, that you have 5 minutes left. And I think that's all for the beginning. So the floor is yours, Jakub. We are looking forward to your presentation on energy poverty.
Thank you very much. I hope you can all hear me. Perfect. Then I'll try to share my screen and we can hopefully start. All right, you see my screen?
Yes, we do.
Perfect. Okay. So welcome everyone. This is a project by me, Jakub Polansky, and my 2 colleagues from the Choro campus of the University of Central Asia, Azmat and Murodbek. And the presentation is titled Energy Poverty in Central and South Asia. So we were guided by the question of what the drivers of energy poverty are, as well as what the outcomes of being energy poor are in Central and South Asia. And as a heads up, I am not going to answer these 2 questions today because this project is still in progress. However, what I would like to tell you today about is the state of energy poverty in Central and South Asia. But first, I'd like to introduce you to the theoretical framework we find ourselves in and start by defining what we mean by energy poverty. There are two major ways to define energy poverty. One is using the resource or access approach, and the other is the capability approach. So while the former focuses on the energy resources one has or has an access to, the latter pays more attention to which capabilities and abilities individuals can realize as a result of using those energy services. And for that, I've highlighted two quotes. The first one being by the IEA, which says that a household having reliable and affordable access to both clean cooking facilities and to electricity, which is enough to supply a basic bundle of energy services. And the keyword here is a basic bundle of energy services, to which I will come back later. And this would reflect more the resources access approach. And the second definition, an inability to realize essential capabilities as a direct or indirect result of insufficient access to affordable, reliable, and safe energy services, and taking into account of available, reasonable alternative means of realizing these capabilities. So here we see kind of the different approaches. In terms of literature, we can focus on either the drivers or outcomes. And in terms of drivers, energy use patterns in households are shaped by the context where people make decisions about which energy source to use and for what purpose to use the energy. These decisions can in turn be influenced by a variety of factors, such as fuel types, demographics, cooking preferences. And the relevant literature is really well reviewed by Muller and Jan, and I recommend everyone to read that publication, who summarize the factors into different categories of income, prices, household preferences, and domestic constraints, as well as production characteristics of energy sources and access. In terms of health outcomes, it's very funny that very little attention is being paid to energy poverty in Central Asia. However, energy poverty is related to household air pollution, and household air pollution from biomass burning causes actually 4.3 million deaths a year, which constitutes almost 8% of the total global mortality and the loss of millions of years of disability adjusted life years. Actually, if we look at the mortality rate of household air pollution exceeds the one of malaria, tuberculosis, or AIDS. It is a major risk factor of lower respiratory infections, including pneumonia, which in fact account for the largest share of deaths in children between 2 months and 5 years of age. It is also one of the major reasons for neonatal deaths in developing countries. And there are many burdens associated with the collection of biomass. On the other hand, having good access to energy is positively linked to medical issues for the availability of medical technology. We'll be also talking a little bit about education in the upcoming paper, and hence I would like to also tell you a bit about the framework of how energy poverty is related to education. And that is with regards to the availability of electric lights, which allows for the extension of the active daytime, which may lead to some rescheduling of time use, for example, in favor of increased study time. The availability of heaters or fans may create an improved learning environment, and the access to technology such as mobile phones or computers can ease access to information. Altogether, literature suggests that access to reliable energy is positively associated to higher school performance, enrollment, and time spent studying. What we believe is very essential when talking about energy poverty is to take into account the gender aspect. And while we know that energy poverty, or conversely, the access to electricity impacts men and women differently, the results from both qualitative and quantitative studies remains relatively mixed. To this day, we do not know yet what the mechanisms are through which women are differently affected compared to men. And on one hand, there is evidence that access to electricity has positive outcomes, specifically for women in terms of education and health. But on the other hand, we find that evidence that improved energy may increase women's burdens. Well, there is evidence that having improved energy sources may also increase the burden on women through an increased workload. And hence we believe that the factors other than access to resources underlie the experiences of women in terms of individual agency and capability, and influence the dynamics of intra-household bargaining, which needs to be taken into account. But today, I will be talking more about the state of energy poverty in Central Asia. So what is it, and how does it look like? First, let's have a look at this map. It depicts the different climate zones of Central and South Asia. And we can see hot desert climates in southern Afghanistan and Pakistan. We see cold desert and semi-arid climates in Tajikistan and Kyrgyzstan. And all between, there are areas of warm continental and Mediterranean climates. And as diverse as these climatic conditions in this research area are, so are the geographic characteristics, energy sources, and energy needs of its people. However, the area is bound together through some commonalities in culture and history, and not at least through common borders. So when trying to compare these countries or coming up with a measure of energy poverty that would apply to all of these countries, we have to resort to a multidimensional measure. And hence why we are employing the multidimensional energy poverty index that was developed by Nussbaumer, Brazilian, and Modi in a paper presented in 2012. Earlier, I quoted the IEA in defining energy poverty, and it referred to the basic bundle of energy services, which we find is problematic as it requires a normative definition of what a set of basic needs is. And it is even harder when considering the cultural, the climatic, the geographical characteristics it needs to take into account. So the multidimensional energy poverty index goes around this by focusing on energy deprivation and quantifying energy deprivation and the ability of individuals to satisfy their energy needs. It leans on established indices like the Human Development Index, the Energy for Development Index, or the Multidimensional Poverty Index. And it creates a metric that provides a quantifiable and comparable measure of energy poverty that allows us to compare the status quo between countries as well as on the subnational level a little bit more objectively than other previous measures did. So when looking at the MAPI, it has 6 dimensions. And this is the original MAPI. I will be also presenting a new adjusted form of this. And the original MAPI covers 6 dimensions. The first dimension is lightning, and it is reflected by having access to electricity, which is obviously a crucial factor for the ability to extend daytime activities, as well as in democratizing access to light. The second dimension is entertainment or education, and it is reflected by having access to a radio or TV, which builds on the idea of the ability to consume information. The third category, household appliances, is reflected by the ownership of fridges, which is essential, obviously, for the ability to preserve food products. The fourth category is modern cooking fuels as a factor defining the ability to efficiently, sustainably, and cleanly engage in cooking practices. And the fifth category is indoor pollution, which is very closely related to having modern cooking fuels, but focuses on whether the cooking method exposes the households to fumes and pollutants. And lastly, the sixth category is communication, which is represented by the ownership of phones. So basically, those were the 6 categories of the original multidimensional energy poverty index. But we decided to enhance it and create a new multidimensional energy poverty index, in which we added the ownership of fans as a indicator that is especially important for a certain area that can create a comfortable living environment. In the communication dimension, we have added computer ownership, as they also have manifold benefits in terms of education, and we removed landlines from the index in favor of mobile phones, as landlines do not require any energy. And lastly, we have also added a category of energy efficiency to reflect the ability to economically and sustainably consume energy. And it's measured by whether a household uses improved roofs and walls. We would also like to add a measure on reliability, but that indicator is not available across all surveys, unfortunately. Looking at the methodology, the MEPI is formally constructed by taking a matrix of achievements for households or individuals and assigning a specific weight to each achievement, such that the weight sum up to 1. And then we identify all households that are deprived from an achievement and count the sum of the weighted deprivation suffered by a household. The next step then involves defining a household as energy poor, based on whether the weighted deprivation count exceeds the predefined cutoff. And with that information, we can create 3 measures. The first measure is the headcount ratio, which gives us a measure of energy poor households in a country or in a region as a share of all households. And the intensity metric, which represents the average of the censored weighted deprivation counts. By taking the product of the headcount ratio and the intensity of the multidimensional energy poverty, we obtain the multidimensional energy poverty index. We will be constructing this index from different data sources, or we did construct it from different data sources, predominantly by using the demographic and health surveys that were collected by USAID, simply because the original MEPI was based on DHS data. It is nationally representative data and includes a broad range of demographic and health indicators. However, the problem is that the DHS data is not available for all countries, predominantly not for Kyrgyzstan. And so we use 2 different sources for Kyrgyzstan. The first one is the LiK Kyrgyzstan survey, and the second one is the multiple indicator cluster survey. The multiple indicator cluster survey has a larger sample size and was collected by UNICEF. It's also a slightly more up-to-date, looking at the year 2018. So what are the results of the research that we have done so far? And as I said, this is work in progress, but a brief reminder first. N here represents the number of households or our sample size. Q is the number of households that are energy poor. K is our cutoff value. H is then the headcount ratio, A the intensity, and MEPI is the final index. What is striking to see that there are very different results on Kyrgyzstan, depending on which data source is being used. To lift this veil of why it is so, these differences are driven by the fact that LiK doesn't allow us to exploit fully the dimension of indoor pollution. And so more weight is given to the households that are cooking with a tandoor oven. And this creates a slightly different result. We would therefore suggest looking rather at the results coming from the MICS data. We see that basically for Kyrgyzstan and for Tajikistan, the intensity of energy poverty is roughly the same. However, Tajikistan has a slightly higher headcount ratio. For Pakistan and Afghanistan, the intensity again is very similar, but the headcount ratio is significantly higher in Afghanistan, implying that a larger share of households is energy poor, and that's why it creates a higher MEPI. when we then consider the new MAPI, we see that the intensity of energy poverty doesn't change dramatically. However, the number of deprived households increases. And here it is very important to note that we need to disregard the LiK data because the sample size drops dramatically to 154 households. That is because of missing data on the availability of the construction materials of roofs and walls. We can also...
Jakub, you have 5 more minutes.
Yes, perfect, thank you. We can plot this in scatter plots and see that both Kyrgyzstan and Tajikistan have the lowest MAPI scores, although Tajikistan seems to have a slightly lower headcount ratio, as I said earlier, but a higher intensity of energy poverty, especially for the new MAPI. What is interesting to observe is that while compared to Pakistan, Afghanistan has a higher headcount ratio in both measures, the intensity of energy poverty of Pakistan drops below Afghanistan's values using the new MAPI. We can see also these dynamics using maps, and the darker the color, the higher the MAPI and the more energy poor is a country on average. We can then also look at the subnational level, where we see much variation across Afghan provinces, with Kabul having the lowest MAPI. And Pakistan, there are also considerable differences between regions, especially when comparing, for example, Punjab with the northern areas. In Kyrgyzstan and Tajikistan, there is less variation, except for the Batken oblast, which is marginally energy poor compared to the rest of the country using the new MAPI. However, what we can also do is to compare urban and rural areas, and this is where the really staggering results come from. What we see is that the intensity of energy poverty doesn't change this much based on the location of the household. So this is given by the factor A, where we take the rural A and divide it by the urban A, and it shows us that basically the intensity of energy poverty in rural and urban areas is roughly the same across all countries. However, the headcount ratio changes dramatically, and it ranges from roughly 2.8 to 22 times the number of people being energy poor in rural areas compared to urban areas. So this is a very drastic result, and it's also reflected in the MAPI factor, where for Tajikistan, actually the MAPI is 23 times as high in rural areas compared to urban areas. So as I said, this is still work in progress. So from this, we can say that the incidence and intensity of energy poverty varies greatly, both on the national and subnational level. When we enhance the original MAPI by additional factors, we see that the intensity doesn't change as much, but the incidence of energy poverty does. And we see the staggering urban-rural divide with regards to the headcount ratio. What we will be doing in the near future, and what we will put out as a paper, is that we will perform further sensitivity analysis using different cutoff values and weights. We will create an energy poverty index on the household level that will allow us to understand the drivers and outcomes of energy poverty. And we will be extending this analysis to the district level of Pakistan, as well as to on the national level to Kazakhstan and regional level to Kazakhstan and Turkmenistan. So if you have any questions or suggestions, feedback, we are more than grateful for it. And we're also grateful for the financial support that was awarded to us through the Faculty Contestable Research Fund. I want to thank the 3 great research assistants from the Khora campus, Aidai, Khonum, and Safdar, and also everyone involved in making the survey data available to us. Thank you.
Okay, thank you very much, Jakub. This is just on time, given the short power cut. So we have a number of comments and questions in the Q&A part. I would like to encourage the rest of the audience to also place their questions or comments there. All of them so far are from Tilman, so thanks Tilman for being very active. But everybody else, please also post your questions here. Jakub, the first point is that concerning your framework, your theoretical framework at the beginning, Tilman wonders if there are other interesting factors at play. For example, does energy poverty also drive natural resource depletion, especially deforestation in Central Asia? And how does energy poverty impact on information and political engagement?
Yes, obviously there's literature out there already on this topic relating energy poverty to the impact on the environment, and we are deliberately not discussing this because we are taking into account the availability of data through the DHS survey data, and this doesn't touch upon the question of the environmental sustainability. So I'm more than happy for anyone who's interested to recommend papers because there are really great papers out there on what is happening in Central Asia in areas that are energy poor and how it affects the environment. And can you repeat the second question?
Of course. Does energy poverty impact information and political engagement?
That would be a very interesting question, but again, we are not envisaging to study this because of data constraints, but I would encourage everyone to explore it.
Yeah, so I think Tilman is probably suggesting to add these points to your theoretical framework, even if you then don't focus on it empirically, just to make it more complete. Okay, then regarding the index, the MEPI, he asks, what about heating energy? Why is that not part of the index? I guess that's the question.
I think my answers will be quite repetitive. Again, the problem is with data availability. If we had good data with indicators on the sources of what energy is being used for heating, then we would certainly include it. However, the problem is that when we are looking at a cross-section between countries, this data is unfortunately not available. So we can only work with whatever is in the existing surveys.
Yeah. Okay. His last point is that for a comparison of the Kyrgyz data sources, LiK and Mix, it would be great to see both indicators using the same limited set of common indicators.
We will actually be definitely doing this just to see whether we can replicate the same results using the two different data sets, because we were quite surprised that when just because of the fact that the LiK for the traditional original MAPI, it is impossible to exploit indoor air pollution as much as with the other data. That all of a sudden, you know, the results change completely. So what we will be certainly doing is to omit this category, reduce the dimensions of the MAPI, and see whether we can replicate the results with the MICS data as well.
Okay. And then we have a question from Aida. She asks about Batken Oblast, which you pointed to. You have shown that the area of Batken is poor in energy. She says it's 100% true. How can I access for this data with the map? What is the source of Batken region energy poor data?
Yeah. All right. So the data on the maps is for Kyrgyzstan is from the MICS survey. So it's open source, available to everyone on the website of UNICEF. You can download it. However, what you cannot download is the map, because this is something that I've created just recently. So basically, first I constructed the MAPI index, and then I created those maps with it. I will, once this project is ready to be published in its final form, I will release all the code and the maps, obviously free to download for everyone to replicate the results. But so far, unfortunately, I'm happy to share the map as of now with you if you send me an email, but it's just preliminary results.
Mm-hmm. Okay, thank you very much. So if there are more questions in the audience, please feel free to add them to the Q&A chat pad. In the meantime, maybe I can ask a question. So you started your presentation by pointing to indoor air pollution and massive use of biomass for cooking. And I must admit, listening to this, I wouldn't have thought about Central Asia. And I wonder what's the magnitude of, cooking on open fire and similar techniques in Central Asia, especially compared to maybe Sub-Saharan Africa or Southeast Asia, where my thinking would go if I hear about these things. And second, why is only the cooking fuel part of the MEPI and not also the, let's say, the type of cook stove? There are these energy efficient cook stoves introduced in many countries. Isn't that also, I mean, still they use firewood, but as far as I understand, they at least reduce the pollution inside.
Okay, so I will answer the second question first. So actually there are two categories. The first category is the modern cooking fuel. So we differentiate between whether a cooking fuel is polluting or not. So we are looking at a differentiation between electricity, LPG, or kerosene on one hand, and then biomass on the other hand. There is no data on what appliance is being used to cook on as broadly. However, what we can use as a factor for pollution is whether the food is being cooked indoors or outdoors in a separate kitchen or in the same room where the majority of household members are in, whether the kitchen has a chimney or a hood in case they are burning biomass. And so for that, we are creating the second dimension, which is indoor air pollution. I wish we had, more data that would allow us to look specifically at what appliances being used. For example, if we are already burning biomass, whether the household is using improved cook stoves. Looking at the personal experience from Central Asia, or looking at the survey data, we see that actually the use of biomass really depends on whether a household is in an urban area or a rural area. So that's why we also see these this really big divide between urban and rural areas in Tajikistan or Kyrgyzstan, for example. One certainly doesn't think directly when thinking of energy poverty of Central Asia. However, what we see that although the headcount ratio of energy poverty in Central Asia is lower than, for example, in South Asia, there is still a significant share of households in the rural areas that are energy poor, and where the intensity of energy poverty is still considerable, and that is largely driven by the fact that these households are not using improved cooking methods. Obviously, compared to the African continent, the situation is much better. It's also visible when comparing the MEPI to results that were found by Nussbaumer in 2012 or 2013, where the numbers for a large share of the African countries is much closer to 1 than what we see for the Central and South Asian continent, where we have values between 0.1 to 0.3 on average. So obviously the situation is much less severe in Central Asia and South Asia compared to Africa, but we still, I think, need to pay attention to it.
Okay, thank you very much. And thank you, Jakub, for the great presentation and the discussion. Thanks to everyone for posting your questions. So we are now turning to the second presenter, the second and last presenter in this session, Stacie Gobin, who will talk about the economic burden of influenza in Kyrgyzstan and also link this to the ongoing COVID pandemic. Stacie, the floor is yours.
Thank you. And thank you for the introduction. Yes, and my colleague Malembe is here as well. We'll be presenting together actually. And let me see, as long as you can all hear me, let me just make sure I can also share my screen. Great. So we're going to be discussing an ongoing study on the economic burden of influenza in Kyrgyzstan. We'll be talking, as I said, the study is ongoing, so we'll not be presenting any final findings or results from the study today, but we'll be talking about the study in the context of the burden of influenza and in the context of influenza within the context of COVID-19. We'll also be talking about the study methods and challenges that we faced due to the ongoing COVID-19 pandemic. And I'm joined today by my colleague Malembe, who is an epidemiologist with the Task Force for Global Health Partnership for Influenza Vaccine Introduction, who has funded this study, and she'll be beginning the presentation, and then I'll be taking over after that. So I'll hand it over to her for now, and I can progress the slides.
Thank you so much, Stacie, and hello to everyone. Thank you for having us here and an opportunity to present our work. So just want to provide an overview of, I'll provide an overview of influenza and the work that's being done in regards to influenza in Kyrgyzstan. Okay, so just on the background on influenza. Influenza is a contagious respiratory illness that causes widespread transmissions every year, and it has the potential for causing global pandemics. And the last pandemic we saw related to influenza was in 2009 during the H1N1 pandemic. Influenza can cause mild to severe illness, and serious outcomes of influenza can result in hospitalization or death. Certain high-risk groups, such as older adults, young children, and people with certain health conditions can develop severe complications from influenza. And influenza not only causes human suffering, but it also has a substantial social and economic impact. It poses large demands on healthcare infrastructure in terms of millions of influenza-related medical visits, which overwhelm medical care systems on a global scale. And it also has a substantial economic cost in terms of sickness-related absenteeism, disrupted work schedules, and lost productivity to society overall. The best way to prevent influenza is by getting vaccinated each year. Influenza vaccines have been proven to be safe and effective, but need to be given annually because circulating strains of influenza viruses are constantly changing from one season to the next. And influenza is a public health problem. A study published last year found that deaths from seasonal influenza over the past 100 years may have exceeded deaths due to influenza pandemic. So that's quite important. And Stacie, if you go to the next slide, please. So every year, there are an estimated 290,000 to 650,000 deaths related to influenza. And countries with little or no seasonal influenza vaccination program bear the majority of these cases. Influenza is also responsible for 10% of pediatric respiratory hospitalizations globally. And influenza-related acute lower respiratory infections for children under 5 can total up to 20 million cases every year. Next slide, please. Now, when looking at defining seasonality of influenza in Kyrgyzstan, this graph shows us the incidence of influenza and for 2016 through 2019. And it shows the severe acute respiratory infections in Kyrgyzstan as well. And so as you can see from the graph, we see an increase in influenza and acute respiratory viral infections from November through March. And there's a peak from late January to mid-February every year. Next slide, please. In 2012, the World Health Organization's Strategic Advisory Group of Experts, which is called SAGE, published a document recommending priority groups for countries that were introducing seasonal influenza vaccines. These groups were health workers, pregnant women, patients with chronic disease, children under 5, and older adults 65 and above. To date, all these risk groups are currently recommended and targeted for influenza vaccination in Kyrgyzstan. Next slide, please. So since 2008, Kyrgyzstan has conducted sentinel surveillance for influenza-like illnesses and severe acute respiratory infections in Bishkek, Osh, and Tokmak. Data from the Sentinel system is reported to Euroflu and FluNet databases on a weekly basis during the influenza season. Also in 2008, the virology laboratory at the Department of the State Sanitary and Epidemiological Surveillance in Bishkek was recognized as a national influenza center by WHO. And so it shares seasonal influenza viruses with WHO collaborating centers. And that helps WHO with determining what strains are being circulating. Next slide, please. Okay, and this table shows a number of seasonal influenza vaccine doses that are made available to the National Influenza Vaccine Program since 2013 in Kyrgyzstan. So as you can see, from 2013 to 2020, government investment in flu vaccine has grown from 6,000 doses to 150,000 doses. Last season, 150,000 doses was enough to cover up to 23% of the targeted population. So it's grown from being able to cover less than 1% of the targeted population to a maximum of 29% of the targeted population. This influenza season, government investment has increased quite significantly in response to the COVID pandemic. And so with the number of doses available to the program, we'll be able to cover up to 46% of the targeted population. It's also important to note that Kyrgyzstan also became a member of the Partnership for Influenza Vaccine Introduction in 2017, which is a 5-year engagement. And so to date, PIVI has also supported facilitated donation of additional influenza vaccine doses during 3 seasons. Next slide, please. So a bit more about the Partnership for Influenza Vaccine Introduction, or PIVI. It's a program of the Task Force for Global Health. It's a public-private initiative that works with government agencies, ministries of health, corporate and private sector partners, and others to create sustainable seasonal influenza vaccination programs in low and middle income countries. It strengthens the immunization infrastructure through facilitated vaccine donations, financial and technical support, and it helps to generate and share knowledge from country experiences with seasonal influenza vaccinations to the global community. Next slide, please. So the U.S. Centers for Disease Control is the technical partner of PIVI and works in other countries, also including Kyrgyzstan, to strengthen pandemic preparedness, vaccine delivery systems, influenza surveillance and capacity of local staff, including epidemiologists, and strengthen access to vaccine and sustainability or multi-year planning for a strong and sustainable vaccine program. Next slide, please. Although PIVI's main focus has been seasonal influenza, PIVI's work with countries provides a foundation for testing plans for pandemics that can be put into action when needed. And influenza systems are uniquely positioned to help countries respond to the COVID pandemic because influenza vaccination and surveillance platforms are currently being used and adapted for COVID detection and eventually will be used for vaccine administration once a vaccine for COVID is available. Next slide, please. So in response to the pandemic, the COVID pandemic, PIVI has expanded its work to provide support to countries in order to strengthen their systems to deploy COVID-19 vaccines and manage successful immunization campaigns. This is a bilateral effort between the Task Force for Global Health, PIVI, and the US Centers for Disease Control. So we are currently working on scheduling calls with select countries to discuss their current COVID-19 vaccine plans and interest in this support. So with that, I'll stop here and turn it over to my colleague Stacie to present on the economic burden of flu in Kyrgyzstan.
Okay, yeah, thank you, Malembe. All right, so as part of our work on influenza in Kyrgyzstan, we took on a study at the end of last year, which began at the end of 2019 to look at the economic burden of influenza due to the burden of influenza and the fact that there hasn't been to this point there's no known knowledge on the current economic burden of influenza or the economic burden to families, out-of-pocket costs of influenza, or the systemic cost of influenza to the public health system. Because of the obvious significance of influenza in Kyrgyzstan, we wanted to conduct this study to learn more about that. So the aims of the study are to explore the costs of influenza from a societal perspective, to compare the cost of illness across the different levels of severity, and to provide evidence to government treatment estimates and factors influencing those estimates to influence sustainability plans, procurement plans, and multi-year plans. To understand the economic burden of influenza, 3 different costs are included in that. Direct medical costs, which include things like diagnostic tests, drugs and medical supplies, physician office visits, and various other types of direct medical costs. Non-direct medical costs, direct non-medical costs, which include travel and other travel-related expenses such as accommodation to get to the point of care, and indirect costs, which are essentially productivity losses. So in terms of our methodology, I mentioned that we're taking a societal perspective. When talking about the influenza burden itself, we're talking about laboratory confirmed influenza in an incidence-based approach. And there's no necessity to do any type of discounting because the time horizon for this study is less than 1 year. The methods for this micro-costing cost analysis are described in the WHO manual for estimating disease burden associated with seasonal influenza, which was published in 2015. So we've taken that basic approach and adapted it to the Kyrgyzstan context. And as part of PIVI, we are also doing similar studies in other countries as well. So we are taking a prospective cohort approach, and we've sampled at both the patient level and the facility level, and collecting costs at both levels, at the patient out-of-pocket cost level and costs to the facilities. And we have selected sentinel surveillance sites in Bishkek, Osh, and Tokmak. So there's a stepwise process for estimating the economic burden of influenza, or essentially estimating the economic burden of any disease. And those steps include identification of the required resources, planning the sampling frame and data collection, measuring hospitalization resource utilization and ambulatory care resource utilization, determining the unit cost of those resources, estimating out-of-pocket and indirect costs, and an optional last step is informal care costs among non-medically attended care.
Stacie, 5 more minutes.
Okay, thank you. So as I said, we're taking a bottom-up micro-costing approach to measure the health inputs and then estimate the unit costs, and you essentially multiply the quantity times the unit costs. I'm going to move a little bit quickly here to account for the time. So our data collection forms have, for our data collection, we're enrollment of patients at those 9 sentinel surveillance sites in Osh, Tokmak, and Bishkek. We're enrolling the patients and then following up with them 10 to 12 days later to collect any follow-up costs that they've received. And our medical staff are doing the enrollment in the initial interviews, and then epidemiologists employed by the Ministry of Health do the follow-up interviews and data entry. So we're moving into the analysis phase now. And as I said, this is an ongoing study. What's really interesting talking about influenza in the context of COVID-19 is that we have run into quite a number of challenges with this study, as you can imagine, due to conducting data collection for such a survey during the context of COVID-19. Our influenza, the influenza coordinator within the Ministry of Health had overall responsibility to oversee the patient level data collection. We had an economist who had the overall responsibility for primary data collection at the health organizations. And we were using Atlas TI database for data collection and for data entry from that data collection. We had some delays due to the pandemic, and I'll talk about some of those challenges and some of those delays. So data collection essentially began in December of 2019 and really was meant to take place between December and March. But beginning in February, travel restrictions, as you know, due to COVID-19 began, and Ministry of Health staff and medical staff began working on COVID-19 preparedness, and we faced some resistance from some of the respondents and some difficulty in collecting the data that we needed. There was also the state of emergency declared and lockdown and curfew in March of 2020. So we had, which led to increased difficulty in us collecting the data, especially because a lot of the staff who would be working on influenza were also responding, and we're also now working on COVID-19 preparedness and response. So it was an additional layer of challenge that we were met with. And to deal with this, we decided to collect supplementary information to deal with this from national level stakeholders, such as data sets and price lists, budgetary information, and cost of routine services, to supplement and some of this primary data collection that we were looking for. And this is a takeaway or a kind of a lesson learned that we're applying to the other contexts in which we're working as well, that some of these national level information can be a really great source of information and supplement some of this primary data collection, especially in this new context in which we're working with COVID-19, where our influenza stakeholders are also dealing with the COVID-19 pandemic, and how can we address these data gaps and additional strain on the human resources with our colleagues that we're working with. So I think my time is potentially up, and I'm happy to answer any questions.
Thank you very much, Stacie and Malembe. I'm sorry I didn't know from the beginning that there are two presenters, actually.
That's okay.
Apologize for that. Right, so everybody in the audience, please feel free to type your questions or comments in the Q&A function, which you find on the bottom of your screen. At the moment, there are no questions there, so I'm going to take the opportunity and ask a question myself. A first question I have is that in your 3 types of costs, I didn't see any costs related to deaths due to influenza, which might be a bit more difficult, but you know, there are probably very direct costs following from deaths of family members too.
Yes, when we are doing economic burden of disease, for some diseases, you do take into account the mortality costs, or it depends on the disease, what the methodology calls for. For seasonal influenza, we don't take that into, it's not part of the recommended methodology. There's not, you mean like loss of additional loss of productivity to the family or something of that nature. It's not taken into account in the methodology for seasonal influenza.
Mm-hmm.
So you're right, it is missing there. It's just not part of the recommended methodology for seasonal influenza. For some other diseases where it is a much higher burden or share of the cost, that would be included.
Okay, thank you. I think okay. Tillman writes that thank you for a great presentation. I come from a different topical research background, but your study reminds me of that work. He points you to 2 studies that he was a co-author of, and it's probably easiest if the host forwards you those references.
Okay,
thank you, Tillman.
Thank you.
Are there more questions? Okay. Again, Tillman says your approach is more an accounting type of framework. As economists, we often try to estimate the opportunity costs as well. So what would have happened without the disease, the burden of the disease? I think it's, if I understood correctly, I think it's partly included in what you called indirect costs. So the loss of income and things like that. But maybe you have additional ideas on this.
Yes, there is productivity. The indirect costs are included. So loss of leisure time, loss of productivity costs, the caregivers and the patient costs, their loss of work time and loss of all of that is included. As I said, there's a similar approach used for various different types of diseases. So it depends on the disease and whether it's a seasonal disease or not. The methodology is changed slightly, and it would include a varying level of those indirect costs and whether mortality or morbidity comes into it a little bit more. But yes, we do include those indirect costs in that manner. But it is, in terms of getting the unit costs and multiplying that by the resource utilization, that is a bit of an accounting, for lack of a better term, exercise to get to that aspect of it, and then using the incidence information to get to the economic burden of disease.
Yeah. Okay. I have one comment here from Elisa. Dear Stacie, dear Malembe, thank you for the detailed presentation. It is indeed very valuable research. I had a question in regard to vaccine coverage in Kyrgyzstan. In the last 2 years, there is a huge increase in vaccine coverage. it would be interesting to know who or which institution is responsible for such a great job. So who's providing the additional vaccines that are now available?
Oh, thank you. That's a good question. And so, of course, national government procures their own vaccines, and we at the Partnership for Influenza Vaccine Introduction collaborate with different manufacturers to get a reasonable or a low cost per dose purchase of vaccines, which we then donate to our partners, our country partners. And so it depends on which manufacturer is willing to work with us. It does change year to year, although we've been able to secure multi-year agreements with manufacturers now. But in the initial stages, it's been dependent on which manufacturer was available to work with us. And this upcoming season, we're working with UNICEF to procure vaccines, but it's all done through PIVI as well.
Okay. Then I would have a final question. If there are no other questions from the audience, please, there's still time for one more maybe. Feel free to write in the Q&A part. So I wonder, to what extent is your research going to be transferable to other diseases? I guess except for the direct cost of treatment, which might differ from disease to disease, the other types of costs should be very similar across, across diseases. So couldn't this very easily become a finding for the economic burden of COVID as well, for example?
Not quite. That's a bit difficult because definitely the cost for each disease is quite different. And we're actually finding this. We're doing a very similar study with PIVI as well in, for example, in Morocco. And we're thinking about, because we're just beginning data collection there, instead of just doing economic burden of influenza, we want to look at the economic burden of the comorbidity of influenza with COVID-19, because the cost will be very different. But go back to your original question, the economic burden and the cost of treatment of each disease is quite different. The out-of-pocket costs and the cost to the facilities. But what is transferable and what is quite useful about these estimates is they're very useful for the government to use for estimating, for budgetary purposes, for estimating treatment costs, for including in their cost effectiveness work to understand the cost effectiveness of vaccinations and treatment programs and prep and any kind of prevention programs that they're going to do that are based around influenza, and for health financing work that they're doing. And that can cross different health areas. So to understand health financing that's across different health areas, to use inputs from one disease will help them to understand how much they can use to budget for other health areas as well. Hopefully my answer was clear, but yeah, the short answer is that the resources needed for treatment for one disease is not going to be the same for another disease, but the utility of the results will be very useful in terms of health financing and budgetary decisions, as well as like sustainability and things like that.
Okay, thank you very much. So I think we've come to the end of this session. I would like to thank the presenters again for their very interesting and insightful presentations. I also thank the interpreters for doing a great job here. And thank you to the organizers of this conference. I hope you enjoyed this session and hope to see you in another one very soon.